It's a pleasure to be here today as a moderator of one of the sessions that is being sponsored by the Hypertension Journal at the Council for High Blood Pressure meeting of 2023. I'm Rhian Touyz from McGill, and I'm here today to speak to one of our experts who's going to be talking to us in the session related to artificial intelligence in hypertension. So welcome. It's a pleasure to have you here with us.
Thank you, Rhian. I'm Sandosh Padmanabhan. I come from Glasgow. I'm a professor of cardiovascular genomics and therapeutics. But my other hat, which I wear, is the academic lead for the Digital Health Validation Lab. And this plans to bring AI innovations into clinical practice, wherein AI is not considered a technology tool, but more of something which can address clinical needs.
So Sandosh, thank you so much for being part of this very special session that, as I said, is being sponsored by the journal Hypertension. So please, could you tell us a little bit about your thoughts related to artificial intelligence in science, in hypertension particularly, and how you see things moving forward in this field?
We live in very exciting times with artificial intelligence exponentially increasing in power and application. So during my talk, I'm going to delve into this fascinating intersection between artificial intelligence and its potential applications in hypertension. I will cover initially I'll lay the context with the Digital Health Validation Lab, where, as I mentioned, we are trying to implement artificial innovations into healthcare, but there are lots of challenges. I will provide some background on the rate of advancement in artificial intelligence that's currently happening around us. I will explain the exponential changes we see in non-medical fields where AI is being applied, and look at how AI can help clinical medicine. So it's not just hypertension, it's across medicine. There are various challenges that we need to overcome.
Yes.
As you know, with AI and machine learning, we need a large amount of data and good quality data. And what we've seen recently is the impact of poor quality data perpetuating societal and clinical biases. It's inadvertent, but that's what the algorithm does. It just works on the data that we have. So we need to guard against these issues when we try to bring AI into clinical practice. More importantly, we also need to evaluate and keep validating these algorithms because things change over time. And finally, from the physician perspective, how do physicians utilize these AI innovations effectively for patient care? It may be that physicians will require additional training. They need to be more adaptable to bring these, to effectively utilize these. And we are again in the area of patient acceptability. Do patients want a fully autonomous AI to decide on their treatment? Do they require a clinician in the loop? So all these are extremely important areas that are being tackled by AI researchers. Ultimately, what you want currently is a close collaboration between clinicians and AI experts to build AI applications that can be seamlessly integrated into clinical care. It will be safe, equitable, and it will produce benefit to patients.
That is so exciting, and I agree this is an incredibly exciting time at every level with respect to data and the impact of machine or learning or AI. So I guess, Sandosh, you highlight something really important, and that is that we need to educate our physicians. But I guess we really need to start integrating this in our medical school curricula so that our students know about the impact and importance of AI. So with that, and you've mentioned the challenges, and how long do you think this is going to take before we can really have validated algorithms that we can be confident with and that our patients and communities and our caregivers are comfortable with?
So what I'll discuss today as well is a major transformational leap that happened in AI around 2070 when a few Google researchers produced something called a transformer model. And that has resulted in ChatGPT. And the power of ChatGPT is not the algorithm. The algorithm is old. It's only 200 lines of code. But the power of ChatGPT is everybody in the world uses it, from students to doctors to technical people, everybody. So what you see here is a transformational leap that has made AI more accessible to others. You don't need to know the innards of AI. You don't need to know how AI works. You just need good quality outputs and a very user-friendly interface. So that leap has really democratized use of AI. So I think some of those barriers against technology are being broken down. We see children and school students, all of them are now talking about AI. So I don't think there is a problem about people accepting AI. I think the problem arises when you think about potential harm that AI can expose people to. And that's quite a very contentious area. You might have heard in the news about big AI experts asking for a moratorium on AI testing and
Yes.
producing these extremely powerful algorithms. So to make AI useful and safe, again, from a healthcare perspective, it's even more important than for advertising or otherwise. So, but we have structures in place in healthcare to look at safety of drugs, safety of devices. We need to apply those same standards. If you look at ChatGPT or these large language models, the reason why all the AI experts have concerns is because of the rapidity with which it started getting adopted into various platforms. We cannot allow that to happen in clinical medicine. So we still need to go through the usual regulatory pathways. We need FDA and other regulatory agencies to bring about practical, feasible regulatory advice on how these need to be integrated into clinical care. So I think it's AI is breaking barriers, but therein lies the power of AI. It can do harm as easily as it can create huge amounts of benefit. This is uncharted territory for us. We've never seen a technology that has transformed so rapidly human life.
It is, as you say, transformational and incredibly exciting. At the end of the day, we want to make sure we have the best care for our patients, absolutely, in a safe and healthy environment. So, Sandosh, we're all looking forward so much to your presentation. Thank you very much, and we look forward to your innovations as you take this field forward, and of course ensuring all that validation that needs to be done. Thank you so much, Sandosh.